Well, thanks, Pete. Training time for the Bellin Run is running out, and joining us this morning is Dr. Thomas Sullivan from Orthopedic and Sports Medicine Specialist of Green Bay. He's here to help us, all 15,000 of us who are already registered to run, and some of us may have some nagging pain. Good morning.
Good morning.
So I'm sure that's common with a lot of them, because you were saying during the commercial break, runners run with pain.
I think it's fairly common when you're training for a large event to have some occasional aches and pains. What's more concerning are pains that won't go away.
All right, so let's talk a little bit about the nagging pains first. We only have, a week and a half before the Bellin Run. What are some of those aches and pains that runners suffer from?
There are a lot of ailments that occur with increased mileage. I think there's probably been a lot of athletes that have been upping their mileage in an attempt to get ready for the run. We worry about plantar fasciitis, shin splints, anterior knee pain, things that affect the runner.
So shin splints are what?
Basically, shin splints are irritation of the muscle and the muscle attachment to the medial tibia, and it occurs with overuse. The danger with a shin splint is that on occasion that can lead to a stress fracture or something more serious.
Is there anything you can make it better before race day?
There are quite a few things. Unfortunately, a lot of it involves rest. More importantly is recognizing whether or not you have a stress fracture. So I usually tell people if they have trouble walking or hopping, it's not a safe incident to run.
That's when you need to rest and see a doctor.
Correct.
Okay, if you can't hop on it, don't run on it.
It's probably not right to run.
Okay, then you mentioned plantar fasciitis.
Heel pain. So a lot of times the heel pad and along the instep of the foot will get quite sore. It's usually sore when you get up in the morning. The best case scenario is it goes away, or it goes away as you run. If that kind of pain persists, then you probably have to see someone as well.
Okay. Is there something to do to relieve that pain, like stretching? Or
a lot of
anything?
times stretching, ice, anti-inflammatories. It's usually a cause of a running imbalance, a gait problem, or muscle imbalance. And usually that can be corrected, but in 10 days it's kind of tough to get done.
And then you said muscle strain is also a common nagging problem for runners.
Almost all runners have some issue, hamstring, quad, calf.
All the above.
As long as it's not bruising or too swollen and there's no issue like that, then I think it's safe to run.
All right, so when is it a point that you need to see a doctor and you shouldn't run?
I think if there's pain with daily activities, pain with normal activities, I think that it probably should be evaluated so you can at least address the problem so that it doesn't continue to be an issue. You don't want to have your Bellin Run turn into 6 months worth of recovery.
Yeah, because a lot of people might only run this run, and
Correct.
It's a 10K.
It is.
So it's not a short distance for non-runners.
This is a major undertaking,
Big deal.
and I think that some of those repetitive stress injuries, that if you push through it in the interest of achieving that goal, you can end up with some significant issues. So I think it's always safer to be checked out.
Are you expecting to see some patients after the Bellin Run?
We normally do. Preferably we'd see them before they get too hurt. But I think that the Bellin Run's a great community event. It's excellent, and we get a lot of participation, so we do see a fair number of folks.
Yep, both of us have done it. We
Yes.
know what it's all about. It is fun to be out there.
Absolutely.
Dr. Sullivan, thanks so much for stopping by.
Thank you.
And we will put a link to the Bellin on our website. I'm sure it's already there. There's a whole banner and everything. It is Saturday, June 14th. Hope to see you there.